Don't forget to like, subscribe and share the videos. Don't forget to like, subscribe and share the videos.
The next topic that we are going to discuss is global impact of lead exposure on cardiovascular health. How is lead exposure going to impact cardiovascular health and what is the global status at present? Okay, so let us understand. It is based on a report. A recent study published in the Lancet Planetary Health Journal, which reveals that lead exposure has significant role in causing cardiovascular deaths worldwide. Let us see the data, the numbers. In 2019, approximately 5.5 million people, which is huge, 5.5 million people succumbed to cardiovascular diseases, which is linked to lead exposure. And this number is 30% of all the global cardiovascular deaths. So of the total cardiovascular deaths, 30% is due to lead exposure. And that is this number, 5.5 million. This is an alarming condition that we have now. Next, the economic cost of the lead exposure, which includes both IQ loss, that is intelligent quotient loss in children, as well as cardiovascular disease deaths. That is, the economic cost is $6 trillion globally in the year 2019, which is approximately 7% of the global GDP, which is again very huge. So these data are important, and apart from cardiovascular disease, lead exposure is also associated with chronic kidney disease, and also developmental intellectual disabilities. So these are also associated with lead exposure. Next, there are countries called low and middle income countries. Those are the countries which bore the brunt of lead exposure related health impacts, with about 95% of the affected population residing in this region. So of the 5.5 million number people who have been affected, 95% of the people are from this low and middle income countries. Next, despite the elimination of leaded petrol, in many countries leaded petrol have been eliminated. Even in middle and low income countries, leaded petrol was eliminated. In spite of that, these countries witnessed 6 times more deaths from cardiovascular diseases than high income countries. Such statements are important, such comparative statements are important. Next is, there are certain nations which is mentioned in this particular study which have highest lead exposure burdens, that is Iran, Afghanistan, Yemen, Peru, Vietnam, the Philippines and the parts of Central Africa. These are the countries which are having highest lead exposure burden, according to this study. We need to understand what is lead poisoning. We are studying about lead exposure. What is lead poisoning? That we need to know, and what are the symptoms of, what are the characteristics of lead poisoning. Lead poisoning is a type of poisoning that occurs when lead accumulates in the body over a period of month or year, and this is caused by absorption of lead into our system. It will get into our system, and it is characterized especially by fatigue, abdominal pain, nausea, diarrhea, loss of appetite, anemia, dark line along gums. These are very specific. Dark line along gums, and muscle paralysis or weakness of limbs. These are the characteristics of lead absorption in the body. That is how it is. I mean, the symptoms are like this. And children are particularly vulnerable to lead poisoning because their bodies are still developing. That is why they are more vulnerable. So this topic becomes important from your exam point of view.